The Victoria COVID numbers have come through just in the last half hour, and there's been another jump in cases. 246 new locally acquired infections have been detected from more than 42,000 tests. And as you can see, that's the biggest daily case number that we've had in this particular outbreak in Victoria. 121 of today's cases are linked to known outbreaks. The state is racing to reach 70% first dose vaccinations when restrictions will be eased slightly. Just over 60% of the eligible population has had one dose so far, while more than 37% of Victorians are fully vaccinated. Reporter Oliver Gordon joins us now from Melbourne. Oliver, g'day. So take us through today's numbers.
G'day, Joe. So 246 cases, a bit of a jump, certainly pretty disappointing for us here in Victoria. Over the last few days, we've seen the numbers in the high 100s, a bit of a plateau, but the 246, a bit of a jump. We know that contact traces so far have linked 121 of those to existing cases, but we don't know how many of these 246 new cases were infectious in the community. That's because the government has stopped reporting on that data recently. So 246 cases, certainly not great news here in Victoria.
And how's the vaccine rollout going in Victoria?
The vaccine rollout is going well. We had our biggest ever weekend of vaccinations over the weekend, and from tomorrow we'll see a Year 12 vaccination blitz. That's expected to go for 10 days, and Year 12s in Victoria can actually go online today and book themselves an appointment. It should speed up the state's vaccine rollout even more. Obviously, we have got this 80% double dose target, but there's a couple of benchmarks or thresholds on the way to there. Over the weekend, we reached the 60% first dose vaccination rate for over 16s. And we're expected to get to the 70% rate in the days just before September 23rd. We'll see some modest freedoms come into effect then. We'll see the 5 kilometre limit move to 10 kilometres and some more time allowed outside. But certainly the focus here in Victoria is on this 80% double dose vaccination rate. We've seen late last week Premier Daniel Andrews talking about this lockout policy where people who don't have vaccines are excluded from sporting venues, public events, pubs, things like that. Over the weekend we saw the organiser of the Cox Plate horse race actually put his hand up and say, look, I'm up for having a no jab, no entry Cox Plate. That's on October 23rd. So wait to see if that happens. We've also seen some trials of no jab, no entry in regional Victoria. There is some good news for regional Victoria. They could be coming out of lockdown, or at least an easing of restrictions later on in the week. But yeah, this case numbers today, Joe, 246, certainly disappointing news.
Yeah. Okay, Oliver Gordon reporting there from Melbourne. The New South Wales Premier says infections will peak in the next fortnight. That's the daily cases, with next month to be the worst month for pressure on the hospital system. Yesterday, the state recorded 1,485 new cases. So that was a second highest day so far, with 3 more deaths. There have been 33,000 cases since the outbreak began back on June the 16th in New South Wales, and 126 fatalities. The state is inching closer to having 3/4 of the population with one dose of a COVID vaccine. More than 73% of people have received their first vaccine, and over 40% are fully immunised. Okay, let's go to our reporters now. Lara Hyams at Sydney's Concord Hospital, and Bill Ormond is in Broken Hill in the far west of New South Wales. Lara, to you first. So thousands of vaccine doses have arrived in Sydney. Take us through what happened with that.
Good morning, Joe. Well, about 450,000 of the Pfizer vaccine arrived in Sydney last night. We're expecting to get another shipment next week. Now, that's according to George Brandis, who's the High Commissioner for Australia to the UK. And that's all part of a deal with the United Kingdom, which will see us receive 4 million doses of vaccine. As part of that deal, we will be repaying the UK once we do get adequate supplies of the Pfizer vaccine. So it's similar to what we had, the deal that we had with Singapore. Both of those countries are sitting on around about 80% double dose. So that will be some real welcome news for us. Also, those doses will be distributed equally across Australia. So not just to the COVID states, it will be working on a per capita basis, and that will be distributed to boost all of the networks. There's also going to be some welcome news too for those authorised workers from those 12 local government areas of concern. Obviously, those workers are required to have a first dose of vaccine when they're going to their place of work. They also have a 2-week extension of when they're supposed to get that.
And pressure is going to continue to build on the hospital system in New South Wales as those case numbers grow in the coming weeks. Explain for us where you are now and what's been the situation in a couple of hospitals around that Sydney area over the weekend.
Well, this is a point that has been conceded by the New South Wales government, that the hospital network is under strain, but it does have the capability to give healthcare where it is needed. That's been a point that has been a disputed point with the Australian Paramedics Association. So this is the union that represents ambulance workers. Last night they posted video on their social media pages showing that some of their ambulances fleet were ramping, spending hours waiting for the patients inside to get a bed. So that was happening here at Concord Hospitals, where that vision stated that it was happening. We know that this hospital has a COVID ward and also ICU capabilities. Yesterday we recorded 175 cases in hospital that are in the ICU ward. Now, the state government says that it has the ability to deliver 500 ICU beds, and if it needed to, that could have a surge up to 2,000. They also say that they have ventilators required on standby if they needed to go to that capacity. But one of the issues has been whether staffing is going to be adequate to meet that demand, and especially given that the next 2 weeks or so we are expected to reach peak figures, that could be a big issue. We have approached New South Wales to inquire what the modelling would be to say how many staffing levels or what that staff would need to be, whether it be at this hospital or others around the network. They say that that is going to be addressed today in the press conference. So expect that to be a main feature of the Premier's message.
Okay, now let's head about 1,000 k's west to Bill Ormond in Broken Hill. Bill, g'day. So first off, give us a bit of an overview of the situation, the COVID situation, the challenges facing regional New South Wales and the resources being deployed there to help.
Good morning, Joe. Well, overall it's a bit of a struggle at the moment, particularly out west. We've got plenty of cases. We believe, we will see the 100th case in Wilcannia today. Add to that, a handful more, maybe 10, 15 cases altogether in Broken Hill, and the health authorities are under quite a bit of stress, actually. So fortunately, they have brought in these 30 motorhomes. They've come from Mildura, Sydney, Melbourne, a few places like that. And there will be for COVID patients and those who are close contacts as well. Now, these homes will have TVs, a shower, a kitchen, bathroom, all these sort of luxuries that will allow people to actually stay in these homes and isolate properly. That's been a huge issue here. Overcrowding's massive in Wilcannia in particular. You see 2 or 3 families all together, 10, 15 people in the one household, and it's just been impossible to isolate and to effectively manage the virus there. So it's a really good sign, and I suppose it's the first step. Some might question, could this have happened quite a lot sooner? It's been sort of a month since the first COVID case, yes, but I suppose it's a good step in the right direction, finally.
And there have been plenty of people keen to donate to help out with Wilcannia?
Yeah, there has. Thousands and thousands all over Australia. We're seeing people donate food, water, aid, essentials, whatever it is, they're donating it, even money. It's been fantastic. A lot of generosity, a lot of the generous Australian spirit, I suppose you could say. And so there's actually a surplus of fruit and veg in particular at the moment in Wilcannia. So it's being extended. Volunteers are now sending that out to stations and a lot of other places. Places like White Cliffs, which is sort of 100 plus k's away, they're getting their food as well and fruit and veg just from the added surplus. So it's really good to see, as I said, on a day where we're expecting to see the 100th COVID case announced in Wilcannia.
Okay, we'll leave there Bill Ormond in Broken Hill and Lara Hyams in Sydney. Daily case numbers are expected to peak there in the next fortnight. That's daily case numbers. But next month is expected to be the peak in pressure on the hospitals. More than 1,000 people are in hospital with COVID now in New South Wales. The death toll from this outbreak is 126, and there is ongoing evidence of the pressure on the system. The New South Wales President of the Australian Paramedics Association, Castelan, joins us now. Castelan, welcome. So talk us through what paramedics have seen over the weekend in Sydney and around New South Wales.
Well, for paramedics, it's the primary route for COVID positive patients to go to hospital. And what we have found is that certainly at the major metropolitan Sydney hospitals have had ramping issues with paramedic crews of up to a dozen paramedics for many hours at a time. Some of the operational frontline paramedics I've spoken to who've been in the job for over a decade have said this is the worst they've ever seen it. The delays are as bad as has ever been seen. And going back a month or so ago, when we're only at 100 or 150 cases, we've really gone into over 1,000 a day now, and we're yet to see significant strategies to ease the strain on the ambulance services and paramedics.
So explain for people in layman's terms what is ramping and what happens when there is ramping.
Yes, well, it's when ambulance crews attend a hospital and they're unable to offload their patients. So the patient subsequently stays on our stretcher, whether that's in the back of an ambulance or in a corridor or in a area for many hours at a time. That means we can't transfer care to the hospital, nor does that mean we can go back out into the community and help further 000 calls. So it puts significant strain on the services there. And we've seen at all major metropolitan hospitals really significant delays or bed block. And it really it makes it difficult for us to respond to the community when they phone 000. And as we know with clinical care, minutes matter when you're responding to emergencies.
So what was the longest of those periods over the weekend when a patient was taken to hospital, the hospital couldn't take them, and that patient then had to wait in the ambulance for a number of hours?
We're hearing multiple crews, particularly at an inner west hospital, a dozen crews being stuck up to 5 to 7 hours at a time. And that puts a significant strain on a really dense population around the inner west. And it also means that paramedics are doing 16, 17-hour shifts without a break. And for us, that is a concern for patient and paramedic safety.
And what is the level of patient care that can be provided in an ambulance compared to in a hospital? Is patient care being compromised in these situations?
We would suggest that patient care can and will be compromised at some point in time. There's escalation strategies if a patient becomes unwell for us to advise the receiving hospital, but certainly waiting in the back of an ambulance for 6 hours at a time when you're a COVID positive patient and you're struggling to breathe is not ideal. And we've seen this strain coming up for a period of time now, many months, and we're really at a point in time where 18 months into this pandemic, we're still struggling with getting patients into emergency departments. So we'd really like to see strategies put in place to ensure that those patients can receive timely care, be offloaded into the hospital system, and we can then go back out to the community and serve them.
Yeah, and what more detail can you give us, Chris Castelan, on the knock-on effects from this over the weekend and the ability of ambulances to get to people after they've been called?
Well, the knock-on effects are that the ambulance crews in these particular areas are unavailable for many hours at a time. So we're pulling resources from the Illawarra, from the Southern Highlands, Blue Mountains, Central Coast and Newcastle, which already have high workload areas as well. But paramedics are being called into Sydney, and I've heard of some crews doing 1 hour or 100 kilometre 000 calls to patients who are unwell. So it's only a matter of time if we don't further put more paramedics on the ground, enhance the strategies to offload our patients. It's only a matter of time that something really significant is going to happen and there's going to be a poor patient outcome. So we'd really like to see a lot more paramedics on the road, more strategies in the hospital areas to offload patients, and more operational support for our members who are there serving the community.
But wouldn't you, as members of the public, assume that there are as many paramedics on the road already? Where are they going to get these extra paramedics from?
Well, this is a real concern for us at this point in time, because the 750 paramedics that were put into the system 3 years ago have already been absorbed and have already been shown to be insufficient for times like now. And don't forget, normal medical and trauma calls are still happening on top of the COVID-19 concerns. So the Australian Paramedics Association has forwarded its concerns to the Minister, and in numerous arenas. And we're always in constant consultation with New South Wales Ambulance to try and ensure that strategies are appropriate, and we're hoping that we can see some light at the end of the tunnel in the next couple of weeks. But as you said, October is going to be a very trying time for paramedics and hospitals.
Yeah, and so pressure is expected to peak on the hospital system next month. What are your concerns about what's going to happen over the next 6 weeks if we're already at this situation now where ambulances are spending several hours waiting to admit patients to hospitals?
Well, it's going to get worse. That's what's going to happen over the next couple of weeks. There's going to be more significant delays, and there's going to be more paramedics stuck at hospitals for longer periods of time. So our concerns are for the community and our paramedics that this will only get worse. And we would suggest that New South Wales Ambulance and the Ministry start talking to us very, very soon about how we can mitigate any potential risks to the community and paramedics as this time comes up. But yeah, it's going to be a very concerning period of time.
But what else can be done at this late stage?
Well, we need to ensure that there's make-ready teams at all the metropolitan regional hospitals. That is where we have cleaning teams, cleaning equipment and ambulances, whilst paramedics are looking after patient care so they can turn around very, very quickly. We want to make sure that there's areas for paramedics that can treat and care for our patients instead of in the back of an ambulance, so that the patients are safe. We also want to make sure that there's rapid antigen testing rolled out immediately across New South Wales to ensure that paramedics aren't putting their fellow co-workers and other patients at risk. And we also want to make sure that there's extra beds put in the capacity into the system so that paramedics can offload quicker to get back out into the community. And we have heard that has slowly but surely been taking place, but our concern is that it's taken 18 months for us to get to this point. So we would suggest that some type of field hospitals or some type of multiple patient area is put in place so that paramedics can offload and the patients are well looked after and catered for to the needs of the current coronavirus pandemic.
Yeah, it's going to be a tough 6 weeks. Okay, Chris Castelan, thanks for talking to us from the Central Coast.
You're welcome, thank you.
Let's head north to Queensland now, and the state remains on high alert as authorities work to trace contacts from a COVID-positive truck driver. Reporter Brittany Klein joins us now from the Beenleigh shopping centre that's just on Brisbane's southern fringe. Brittany, g'day. So what's the latest on the situation there?
Yeah, good morning, Joe. Queensland health authorities are still asking anyone who was here at the Beenleigh marketplace, like you said, about 30 minutes south of the city, to come forward and get tested. We know that the truck driver was here last Monday and spent some time particularly at a nail salon. But Queensland health authorities are worried they haven't been able to get in touch with everyone who was here at the same time because they didn't use the Queensland Health app properly. We know that 2 close contacts of that truck driver from Logan, a 4-year-old girl, and now her mother have tested positive to COVID-19. Queensland Premier Anastasia Palaszczuk is very determined to keep numbers low in the state of Queensland, so much so she put a pause on Queenslanders even returning home and spending time in hotel quarantine last week, saying the system was simply overwhelmed. But she came under fire for that decision when just days later she invited hundreds of officials and family members from the NRL into the state. So she's since apologised for that decision, and today we'll see about 680 rooms reopen, Joe, for Queenslanders wanting to return home.
And Brittany, those images yesterday on Father's Day of families gathering kind of over that border, the orange barriers, really highlighted this discussion around the border bubble and the challenges facing people there. Where's that discussion at now?
Well, that's it, isn't it, Joe? The Queensland Premier Anastasia Palaszczuk has held such a tough stance on the border situation for some time now, and like you said, those images of families who live just streets away in the town of Coolangatta in particular. We were there yesterday and we saw them having to bring out their camping chairs and have picnic lunches and celebrate Father's Day like no year before, separated by those plastic orange barricades. There were even police out in force, but instead of fining people like they have in the past, they were showing compassion and just handing out face masks and asking people to be socially distant where possible. We're expecting an update from the Queensland Premier later this morning morning, but she says she is continuing to work with her New South Wales counterparts, particularly Gladys Berejiklian and the New South Wales Premier, on coming up with some kind of contingency plan and perhaps a so-called border bubble around those towns.
Okay, Brittany Klein reporting there from Beenleigh. Okay, let's head to the ACT now. 70% of eligible Canberrans have now received their first dose of a COVID vaccine. The ACT recorded 15 new cases yesterday, 13 are linked, while contact tracers are investigating the 2 others. Up to 9 people were in the community while infectious. Now let's head to South Australia, where the Premier is hopeful the state has avoided another COVID outbreak. More than 500 people are in quarantine after being linked to 5 COVID-positive truck drivers from New South Wales who visited multiple locations in the state over the past fortnight. No local cases have been found so far, but the Premier has warned the state isn't out of the woods yet. And just before we go on, I'll mention that raft of media conferences that we've got this morning, starting from in about 20 minutes' time, 10 o'clock Eastern Standard Time. So Queensland Premier getting up then the Prime Minister addressing a women's forum in Canberra, then the New South Wales, Victoria and ACT media conferences expected in that 11 o'clock hour. That's Eastern Time once again. So we'll be bringing all of those to you live in some form on some ABC platform, and I'll keep you across that through the morning. Community leaders have expressed concern about groups spreading misinformation about coronavirus. In Melbourne, ethnic communities have been targeted by anti-vaccination activists. Ahmed Hassan, a youth community advocate, was targeted himself after recovering from the virus. He says far too many people are being misled.
There's a lot of fear around it. There's a lot of misinformation around it. And, misinformation currently is leading to hospitalisation. And I can see that because many people I've spoken to have been hospitalised as a result of not understanding what COVID-19 is and not taking precautions. I tell a lot of people in the community, in 2020, there was no vaccine. In 2021, you can actually avoid it. There is a vaccine and you can avoid hospitalisation. So that's my message, basically. We've got a lot of great people in the community who we use many different channels, whether it be through families. We use young people who are educated, who are willing to explain to their parents. But also we're talking to mothers. We're talking to families to better educate and understand what COVID-19, what the vaccine is, what precautions we can take. What we're seeing is a lot of people are waiting too long to get tested. A lot of people are even waiting for too long to present to hospital. As someone who's presented to hospital twice, my advice is, if you're not feeling too well, don't wait. It's not the common cold. A lot of people are, just flagging it as a bad flu, and it's pretty serious. I am certain for once that there is enough information out there. I think it's for the individual to go out and look for the right information. There's a lot of misinformation, and it is so consistent and persistent, in terms of targeting different cohorts and in social media. My advice is to speak to your doctor, speak to people who are, who know exactly what's going on, not fish for information online or from friends. It's great to see the leadership of the Australian Islamic Centre in Newport setting up a vaccination hub for the community. And I'd like to see more of that happening across the community, because I think that will bring together, like what we've seen at Tackle College earlier, in the lockdown 6, where they actually set up a testing and a vaccination centre where the communities can actually come out, speak to doctors, speak to people who are out there about, what the vaccine is and what it means for them.
Russia has recorded 7 million coronavirus cases since the start of the pandemic. In 24 hours, the country had more than 18,000 new infections and close to 800 deaths. While the Russian government has the official death toll at 187,000, a state statistics service estimates that at least 365,000 people have died. And thousands of people have marched through Amsterdam to protest against coronavirus restrictions. The Dutch government has eased most rules, but social distancing rules are still in place, and a vaccine certificate is needed for travel. An estimated 75% of adults are fully vaccinated, and weekly infections have been stable around 100 per 100,000 people.